All right, so my project or my presentation is Economics and Healthcare Policy, an analysis of two viewpoints. It was just something I worked on for a ethics class we take here at Marion. So I thought it was just an interesting topic. I'm going to start with a quote by Murray Rothbard. Some of you may be familiar with him. It is not a crime to be ignorant of economics, which is, after all, a specialized discipline and one that most people consider to be a dismal science. But it is totally irresponsible to have a loud and vociferous opinion on economic subjects while remaining in this state of ignorance. So I say that because when I first read this quote, it really encouraged me to think more critically about what I see and hear in the news, and then to kind of do my own research on things before I talk about them. Economics plays a huge role in just about everything we do, and at times governments, they can't change the principles, but they can try to change perceptions, and so that's just kind of how I see things. So the articles I discuss mainly are by Len Nichols. He takes a more government intervention approach to healthcare markets, and then the opposing viewpoint is Robert Sade. He has a more free market approach. So Nichols, he says the 5 economic functions of government that most people agree with are to define and protect property rights, finance public goods, correct serious externalities, maintain competitive market conditions and performance, and then to correct an unacceptable degree of income inequality. With what Arthur Brooks said yesterday, we're going to try to come to unity for at least the first one, and that we both agree. Nichols thinks that governments are used to define and protect property rights and necessary for all markets to exist. And then Sade would also agree that the government can be used to protect property and prevent fraud through a national defense, police, and then a court system. With that said, I don't agree with Nichols to the full extent because I don't think government is needed for all markets to exist. I think the black market is a perfect example of that. To finance public goods is the second one. So a public good is a product one individual can consume without reducing its availability to another individual. So national defense, court system, police, the roads. Nichols says that programs like the NIH and Agency for Healthcare Research and Quality are public goods and are needed because without government funding, there wouldn't be enough research done, and then there wouldn't be anyone to disseminate this information. Sade would agree on a national defense, court system, police, and whatnot, but he would disagree in going as far as having the government fund the NIH, the FDA, AHRQ, CDC. So the Health and Human Services has nearly 20 divisions. NIH, CDC, FDA, CMS are all under that. Each program has their own regulations. Many of those regulations are very redundant. And in 2015 alone, it costed taxpayers over $1 trillion, which is just kind of crazy. The NIH had a budget of $32 billion in 2011. And some examples of their research that is so important is if rats find Miles Davis better with cocaine, if labs are stressful environments for monkeys, and that was a 51-year grant that's still continuing, and then if drug-induced arthritis in rats makes it harder to exercise. So yeah, those are just some interesting topics. So these tables, they both show just kind of like the regulation in Medicare. The top table shows a few different columns. It's probably hard to read for you guys as it prints small. But all those check marks show all those programs that do all the same things. And so you can see there is a lot of regulation that is overlapping, and it is kind of completely redundant. 85% of the Health and Human Services budget goes into Medicare and Medicaid, and none of this actually goes into treating patients. It's all compliance. So I just think that's kind of interesting. With that said, there are also many private organizations that do a lot of the same functions as the NIH or the FDA or CDC for that matter. So we got the American Academy of Family Physicians, UpToDate, American College of Physicians. They all have their own clinical guidelines, recommendations, regular updates. They have their own journals citing new research, public health alerts. They even have classes. The third function, according to Nichols, was to correct serious externalities. Externalities are costs or benefits that affect a party who did not choose to incur that cost or benefit. Examples: pollution, education, resource misallocation. Nichols said that without government investments in standard-setting regulations, we will have suboptimal resource allocation in goods and services that produce externalities. Sade summarizes Ludwig von Mises. Some of you are familiar with him. He's an Austrian economist. He says that resources can only be allocated appropriately through supply and demand-driven price fluctuations in a free market. When a central planner takes control of resource allocation, they don't normally know what the prices are, and so it leads to shortages or overproduction in certain markets. When that happens, then government makes laws and regulation to try to correct those problems, leading to unintended consequences, leading to more laws and regulation, leading to more unintended consequences. It just creates a downward spiral. And so a perfect example of this is kind of like Obamacare in its current form. There's a lot of problems that came from it, and now we have a lot of people that were for Obamacare are now arguing for a single payer system just to kind of get rid of all these problems. And that's, in my opinion, that's probably not the answer. And I think you guys would agree for the most part. So these are a couple of quotes by Mises. I don't have time to talk about it, so I'm just going to let you read them if you're interested. I can show you later. The fourth function is to maintain competitive market conditions and performance. Nichols says that market performance is comprised when monopolies exist in an industry and there are barriers that prevent entry of competitors to exist. Also, product quality is a big problem. And because of these failures in the market, we have things like the FDA, state licensing boards, federal antitrust laws, insurance regulatory boards. Sade would argue that regulation, especially over-regulation, can lead to monopolies, and that product quality can be undertaken by private entities, like I described earlier on. Also, doctors, they have a fiduciary relationship with their patients, and so they take things like the Hippocratic Oath. They should always have the patient's best interest in mind, so what's the purpose of the government regulating these things for performance? One of these programs that is made to regulate the market is the FDA, and so some of you guys may be familiar with Turing Pharmaceuticals and Martin Schmale. I don't know if I said that right. He boosted the price of Daraprim 5,000% overnight. What he did was technically legal. He didn't do really anything wrong. I mean, ethically, it may be wrong, but what he did was he just kind of took advantage of the FDA in the sense that he bought an old patent of a drug that didn't have many indications of use, and there were few drugs that had that same indication. He created a shortage of that drug, and then he boosted the prices knowing that people were going to have to buy it. The FDA created a bottleneck on indications of drugs like that kind, and so he knew that he was going to have a monopoly on this type of drug for many years to come because it takes years and billions of dollars by companies to get approval for drugs of that same kind. So he was just kind of taking advantage of the system. The FDA, to approve drugs, they have to be safe and effective, and the FDA doesn't have, they're not 100% perfect in how they approve drugs. DES was a perfect example. It was on the market 30 years. It was used to decrease pregnancy complications. They found out it causes clear cell carcinoma. And so they revoked that. Vioxx is another example. They approved it. It's on the market 5 years. It led to between 80,000 and 140,000 serious cardiac problems. 30 to 40% of those were fatal. So that was interesting. Another way to look at it is it takes a long time for the FDA approval process to work. Beta blockers, the lag by FDA approval could have possibly led to 250,000 lives lost. Beta blockers were approved by Europe in the late 1960s. It took 3 years after Europe to approve for the FDA to approve in the United States, and it took another 10 years for them to approve beta blockers for indications like hypertension or angina. So another quote by Milton Friedman, just talking about government solutions and how the same market failures are hard to figure out for the market, the free market. So they're going to be hard for the government to figure out solutions as well. And when government comes up with a solution, if it fails, it has all these laws that come with it, and so it normally leads to a larger failure. So the last function of government, according to Nichols, was to correct an unacceptable degree of income inequality. Nichols calls this an enlightened self-interest. Extreme inequality may lead to social tension, violence, and therefore voluntary taxation to provide for the poor helps increase social and economic freedom for the taxed. According to Sade, welfare laws displace voluntary charity in the name of social justice. Also, governments kind of just breed dependency on government handouts, breed dependency by those that take it. And then long term, this doesn't correct the solution, it just leads to more government programs. Social pressures are actually, within a community, are more effective than federal programs. So we got a quote by Benjamin Franklin. I'm not going to go into it, but it just kind of shows what, back then, he kind of had the same idea on things as what we're starting to learn, well, what we know now. So role of government in markets. Sade argues that the government should use the principle of non-interference in the healthcare market. He notes that the difference between the private sector and government is that governments have monopoly power backed by force. Governments also don't face competitive pressures like the private sector. They can ask for more money to fix problems. They don't always have to worry about their job security. Sometimes, they could have a problem and they don't have to worry about getting fired. And so some perfect examples of this are Flint, Michigan. These are all pretty recent events, but about 2 years ago, the government knew that there was this water problem in Flint and nothing was really done about it. And it actually took a doctor in Michigan to kind of step up and initiate the government to actually start taking care of this. Another example is the Animas River in Colorado. The EPA unintentionally dumped tens of thousands of toxins into the Animas River while trying to clean a gold mine. It took them 24 hours to notify anyone that this happened. The estimated cost to clean this all up is $50 billion that then come from the taxpayer. And no one has yet been fired from this, and this happened 6-7 months ago. The U.S. Postal Service is another great example. Since 2006, they've lost $47 billion, yet they're still a company, a government-funded company. And they have a monopoly on the service, technically, and they still lose so much money. Education is another big example, and we're all students, so we kind of know. Since the early 2000s, the federal government got involved in student loans, made it harder for private companies to give out student loans, and since then we've had a huge inflation in secondary education costs. They allow everyone's guaranteed a student loan, and colleges know this now, so they can boost the price to whatever they want because they knew students are going to be able to get loans from people or from the government. So the role of government in healthcare, possibly one of the biggest problems right now is increasing healthcare costs. So this is a graph from the Bureau of Labor Statistics from 1970 to 2009. In 1970, for every 2 physicians, there was about 1 administrator. In 2009, for every 2 physicians, there's about 10 to 12 administrators. Also in that time, that black line is increase in healthcare costs per capita. I don't want to say correlation equals causation, but if all these administrators are put in place to make sure they're compliant with government regulations and/or insurance regulations, I think it's a legitimate question. So this is another table, and it just kind of shows CMS and then hospitals and then all the government agencies that put regulation on hospitals. And so I think 1/4 of all costs by hospitals go to administrative costs. Same is true with a lot of private practices. So a quote by Thomas Sowell, it is amazing that people who think we cannot afford to pay for doctors, hospitals, and medication somehow think we can afford to pay for doctors, hospitals, medication, and a government bureaucracy to administer it. I think that's a great quote. So Sade poses some solutions just to allow health insurance to be purchased across state lines, reform the tax system to allow individuals to get tax deductions for health insurance like companies, repeal the forced purchase of unwanted benefits in healthcare or in health insurance, deregulate the healthcare industry, reform Medicare and Medicaid with a means test so people like Warren Buffett aren't able to get money from Medicare when he can obviously pay, and then encourage price transparency in the healthcare industry. These solutions aren't going to prevent market failures. That's the key thing. Market failures are always going to happen. But when we get government out, it allows the free market to fix these market failure is a lot faster than the government, and then we don't have all the regulation and everything that goes with government. And that's my presentation. Thank you very much for listening.